Hi there, my name is Dr. Michael Wald, the Blood Detective, and today's podcast, The Best Protein for Heart Disease, What You Need to Know. So I decided to do this presentation because this is an article that's been trending, and it was titled something like, Here's what the cardiologist eats, believes is the best protein for heart health. And I read the article and I was disappointed because most of these articles on health, they're very superficial, as you'll see in a moment. So I'm going to review some of the statements made in that article and then correct them. And there'll be obvious corrections. Even you shall understand this. So for those of you who don't know me and are joining me for the first time, welcome. I'm a doctor of chiropractic. I'm also a board-certified nutritionist with a master's degree in nutrition. I'm a sports nutritionist, and I'm a dietitian. I provide life coaching to my clients and acupuncture, and I have a medical diploma, but not an active license to practice medicine. So this information that I'll be presenting to you now is for your education. It's not meant as a substitute for sound medical or health advice. So the article says fish, especially fatty fish such as salmon, sardines, and mackerel and tuna, are identified as the top protein sources. And I would say that those are pretty good protein sources. Technically, are they better protein sources than red meat? No, but there are reasons to have fish, and that's obvious. So these fish are rich in long chain omega-3 fatty acids, and most of you have heard of the two major ones, EPA and DHA. And these are known to reduce inflammation and also help improve lipid profiles like lowering total cholesterol, raising the HDL, lowering LDLs, and lowering triglycerides, as well as help heart muscle function. Sounds good so far. Fatty fish generally contain less saturated fats compared to many red meats, making them more heart-friendly in terms of lowering LDL and minimizing the risk of atherosclerosis. I definitely agree with that. This article draws on recommendations from the American Heart Association and leading cardiologists who emphasize including seafood in a heart-healthy diet. Again, this is nothing new. Hang in there. Now, they do say correctly that the optimal approach for heart health is not just to have fish as protein, not just have one protein, but incorporating it into a broader dietary pattern, such as pescatarian or lots of fish with a Mediterranean approach added in there with amounts of olive oil and other healthy fats like monounsaturated from avocados, for example, omega-9 fats, which you'll find in the olive oil, and other healthy fruits and vegetables, all the things characteristic of a Mediterranean diet. And the DASH diet is one that lowers blood pressure, low sodium foods. I figure out dietary advice for my clients based on their chemistries, based on their health histories, their health goals, the medications they're taking, and frankly, what they can do and their ability to comply with things. Then I figure out a food plan that matches their chemistries. But in general, having a pescatarian, Mediterranean, or DASH style diet seems reasonable on paper. But if you have any particular health issues, you suspect autoimmune conditions, you might have a thyroid issue, whatever the issues are that may change the food recommendations completely. So the article includes at least 2 3-ounce servings of fatty fish per week to gain the cardiovascular benefits. So 2 3-ounce servings. Now, if you were pregnant, that would not be okay. You would want to consume fish no more than once per week. If you are a small child, fish no more than once per week. Why? Because they contain heavy metals most often, cadmium, lead, mercury, and they bioaccumulate in small bodies like little kids, in older people, and in pregnancy. And the fish intake recommendation for pregnant women used to be 3 servings a week. Then over time they converted it to 2. I believe now it's 2, but I go for 1. But I also check the metals because these metals can cause birth defects. Although the most common cause of birth defects is folic acid deficiency. Let's continue. Now here are some 6 reasons why this protein source, meaning fish, may not be such a hot idea for everyone. And the article completely ignored these things. And they ignored these things, in my opinion, because they don't know these things. And they don't know these things because when these magazines find a cardiologist or a doctor to call to do an article, as I've received the calls, they may not have the knowledge they need. And this is what you're getting. So for example, if we overcook the fish, especially at high temperatures for a long time, that can generate harmful compounds, oxidating the lipids or the fats of the fish, forming advanced glycosylation end products or AGEs, and possibly increase saturated fat if skin and fatty components of the fish are grilled or broiled improperly. And therefore, you're going to neutralize the cardiovascular benefits. Not only will you neutralize them, you'll increase cardiovascular risk because these glycosylation end products are quite damaging. And then if you overcook the fish, the unsaturated oils in the fish can become saturated oils, and it's saturated oil in the diet or fats in the diet that raise cholesterol, not cholesterol in the diet. Fatty fish also may contain heavy metals, as I've mentioned. For example, mercury, lead, and cadmium, and other environmental contaminants like dioxins and PCBs, especially in larger predator species. They'll pose the greatest risk, especially to pregnant women and to children and those with impaired detoxification mechanisms, which are generally people who are kind of sickly. And for people with seafood allergies or sensitivities, obviously fish may not be a good choice. Some individuals follow vegetarian, vegan, or plant-based diets or have ethical or religious dietary restrictions, making fish not acceptable or desirable for them. So in some cases, relying solely on fish may not align with personal or cultural frameworks, so we have to deal with those. And that's fine. People will say to me, Dr. Wald, well, what's the healthiest fish? Well, you can look in a book and it'll tell you which fish is higher in omega-3s, but that doesn't mean that the fish you have actually is. Also, they'll even tell you which fish may have more heavy metals than others. That I have found to be completely inaccurate. So you just have to check each person if they're considering using fish as part of their therapeutic regime or their diet. You should probably do a baseline heavy metals test on these people. And those with kidney impairment or certain medications like anticoagulants, there may be fish oil interactions. So fish is a blood thinner, and if you're on a blood thinner medication, you could increase your risk of stroke. Now, if you had thrombotic stroke, clotting stroke in your past, and you're not on a blood thinner because you want to do things naturally, fish or fish oil would certainly be important for that, along with vitamin E, maybe ginkgo, and there's several other nutrients that are very, very good at thinning the blood. But you want to do that under proper supervision because you don't want to create too much blood thinning, and you certainly don't want to go in the reverse. So fish do have heavy metals, and heavy metals are quite toxic to the renal system or the kidneys. So once again, if you have any renal issues that you're aware of, you want to get checked out for heavy metals. And if you do not have heavy metals, the omega-3 fatty acids are very useful for renal recovery. Now, the benefit of fish depends on its quality and its freshness. If the fish is poorly stored, if it's spoiled, obviously, or high in saturated fat, for example, fatty fish preparation methods such as breading or deep frying, or these are obviously adverse and will make the fish more and more unhealthy. I like to use an air fryer. The food tastes amazing. You just put some spices in there, and the fish comes out fantastic. You don't need oils. You can cook it slowly over a reasonable period of time, and you're going to minimize the damage to the omega-3s in the fish. And then you have some of the blood detective laboratory tests to think about to see if you're benefiting from the fish in the way that you want. Now, there's an omega-3 index which measures the levels of EPA and DHA, and then these fatty acids, they produce other fatty acids, and these tests, the omega-3 index, can measure a lot of them so you can see exactly where you're deficient, and you might be able to take a supplement for that or possibly eat something that fills in that fatty acid deficiency. Now, I mentioned earlier that fish is EPA, DHA. Now, the EPA is more helpful for the cardiovascular system. I'll say that again. The EPA is more helpful for cardiovascular problems. The DHA more for neurologic problems, dementia, memory, all the special needs conditions, neuropathies, multiple sclerosis, for example, DHA. And then there's the lipid panel, which includes LDL, but you want to know the particle size of LDL. Is it LDL large particles, LDL small particles? The same thing with the HDL and the triglycerides. Then you want to do a heavy metal panel. Sometimes I'll do a blood level and I'll do a 24-hour urinary excretion. And then, of course, when we're dealing with fish oils, we want to know, are they producing the desired anti-inflammatory effects and not causing inflammatory effects or oxidative stress? And you can order an inflammatory oxidative stress panel. So that about does it for the fish. I hope you've gotten some takeaways. I prefer air fryers. If you purchase fish in fish oil capsules, for example, you want to get a third-party assay from that company and make sure there's no heavy metal contamination in it. And of course, the fish would be added to a balanced diet depending on what that needs for your particular health needs and goals. Thanks very much for joining me, and I'll see you at the next podcast.